And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. And Tamiflu, something that we've heard lots and lots about, especially during flu season. So a good drug to have, but how soon do you need to call the doctor if you feel like you've got the flu?
I mean, as soon as possible, within 48 hours, as the segment indicated. You know, flu actually is a very abrupt onset of symptoms. A lot of achiness, dry cough, fever. It's sudden. It's like from 1 hour to the next you have these symptoms, and so you feel from 1 hour you just feel terrible, and you know that's the flu, achy, fever, coughing. And the Tamiflu works very well. I actually use a lot of Tamiflu in the office, especially if they come in within 40 hours. But if patients are hospitalized and we feel like they have the flu or they test positive for the flu, we will still use Tamiflu in the hospital, even though it's been 36 hours, maybe longer, 3-4 days, just because research and studies have indicated that it still is effective to help fight the flu virus in that instance. So it's a very good product. It's been around for a long time, very well tolerated. Sometimes we have issues of supply and demand, especially during this peak time of the year, but so far so good. So if you feel like you have the flu, I think the bottom line is get in and see your healthcare professional. Don't wait until Monday. If it is Friday, go in and get help and checked out and get on the medication. So.
All right, on to some of our viewers' medical questions. This person, is it possible for a brain tumor to remain dormant in your brain for 15 years? It happened to my husband. It was discovered that he had a brain tumor.
Yeah, you know, a lot of times with these tumors, biopsy is the way to diagnose them, but certainly with MRIs, the radiologists, as well as neurosurgeons, have the ability to look at certain characteristics of the tumor and say it is benign or if it's malignant. So it is true that you can have this meningioma stay there dormant, don't have to resect it. Normally they do resect it or take it out if it starts to grow and cause mass effect or neurological conditions. But it's just like the bullet that enters your body. You don't necessarily have to take it out if it's not causing any problems.
It
can stay there, absolutely. Based on symptoms, normally we would send this person to a neurosurgeon. They would follow it, get serial MRIs, see how your symptoms are going. But if you're asymptomatic and it's just sitting there, no reason to open up the skull.
Okay, another question. A recent CBC showed my hemoglobin level to be 8.5. Is this low enough to need a blood transfusion?
But not necessarily. If this person did have symptoms such as shortness of breath, passing out, weakness, then I might go ahead and give a unit of blood. But if this person was completely asymptomatic, then I wouldn't necessarily give them a blood transfusion. We're actually lowering our demand for blood transfusion, or when we start giving blood, even down to 7, sometimes even in the hospital. And this is all based on the issue with giving blood. Giving blood is not, or I should say receiving blood is not a benign issue. It can cause a lot of side effects in terms of immunological reactions, volume overload, so it's not something that needs to be taken lightly. So we're trying to make sure that when patients get it, they actually need it. So we're lowering our standards a little bit, but if they have symptoms, or if they have heart disease or a heart attack that was recent, we probably want to do it above 9, 10. Certainly if they're actively bleeding, we certainly try and keep up with the blood loss, but 8.5 asymptomatic probably would watch that.
This person, the RX told me there is a narcotic in Lyrica. I did not find anything like that online. I am taking it in place of hydrocodone.
Technically, as far as I know, Lyrica is not a narcotic, doesn't contain a narcotic.
Hydrocodone is.
Hydrocodone is, absolutely, but I don't know that Lyrica contains any type of components such as hydrocodone. We actually like Lyrica because it is a non-narcotic and has a low abuse potential. As you know, there's heightened awareness with these narcotics, and there's a lot of things going on to try and reduce the risk of patients taking narcotics. So alternatives are medicines like Lyrica, which we use for nerve pain, fibromyalgia, headaches sometimes. So it is a good product, but as far as I know, no narcotics.
Okay. What can marijuana do for children with epilepsy? I've read many articles claiming its benefits.
You know, that's come up a lot with the issues of it being legalized and all, you know, it's been around for a long time in terms of treating nausea in patients who have terminal illnesses. In terms of this question, I actually don't know how it helps kids with epilepsy. Certainly, I think you can find anything on the internet that claims that marijuana helps patients with
especially if you go to Colorado or Washington.
Absolutely. So, you know, all studies are not equal. All studies are not the same. So you have to be careful what you read on the internet. Certainly, this is going to be an ongoing issue because some diseases, really, we have no therapies or treatments for them. As you know, every illness does not get proper research. It doesn't get the money behind it. And so from 1 to 20 years, we're really no better at treating it. And so people are looking for alternatives out there. Marijuana has been discussed so many times, but certainly I don't have any other comments on that. Certainly work with your doctor when it comes to that.
Okay. For the past month, I've been itching at my joints. I haven't done or taken anything different. I've tried Benadryl, anti-itch creams, and nothing seems to help.
Yeah, itching comes up a lot. Certainly, I'd probably do some blood work, check their liver counts. There's what we call CBC, which is their blood count. Benadryl is a good product. Antihistamines such as Claritin, as well as Allegra, are also good antihistamines. There's some prescription antihistamines as well that work with itching. But we're trying to find out why. Certainly, if it's something focal or local, we try topical therapies first, but sometimes a biopsy if there is a rash there. But it sounds like an unusual situation. Because it's around the joints, maybe it's an arthritis, but they feel like it's itchy, but it could be joint inflammation. So blood tests can figure that out, as well as a trial of some anti-inflammatories such as Motrin, Advil, or something like Celebrex.
All right, Dr. Levine, as always, we appreciate you
Yes,
stopping by and answering questions. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com or post those questions every Monday on our KFTM News Facebook page.